Here we are with Justin, post-thoracic outlet surgery. We're gonna go through some exercises, what he needs to do and needs to continue to work on to improve his posture, improve his stability around the shoulder, and get back to throwing at a high rate of speed following this surgery. Hey, Max Wardell, Overhead Athletics. As you saw, we're today with Justin, and Justin's going through his exercises after thoracic outlet syndrome surgery, where they actually removed a significant portion of his first rib, almost the entire thing. When we have something major like this in terms of surgery, we know the rehab process is going to take a while, and Justin's into it a little bit now. We've worked all the way from very basic things up to where we're at now, where he's doing a bit of throwing, and if you haven't yet, go check out that video. Just some considerations to think about as you get back into throwing. And that's why we've put together some of those return to throw programs on our website for guys to follow. But in person, we want you guys, thinking about a few different things as far as how you tension the nerves. So that's in our previous video. This video is all about the exercises that you're gonna do to get your arm strong, your trunk strong, shoulder strong, and then improve posture where necessary. The first thing we like to do is get something that's unstable, like this aqua ball. And we've got Justin doing laps resisted into internal rotation, so the external rotators of the shoulder are working, and then vice versa, and he's doing a little walk, which gives us a little bit of instability back and forth. Now, if you don't have an aqua ball, there's other things you can do here. We like the idea of doing something with maybe a body blade or a shoulder tube or a TheraBar, but we love the aqua balls, and we'll train with those all the time as our warm-up, get the shoulder activated, train some contraction of the muscles in the positions we want them to be when athletes go into the throw. And then from there, we start to work on thoracic rotation and the ability to rotate through the thoracic spine with postural control and with core contraction. So all the way to the end range in both a lift and a chop variation. We've got Justin doing lunge stance variations now, which is close to the position where he's at in the throw, and he's got to control the motion, trying to increase the degree to which he can rotate, as well as the amount of resistance he can take to his end range, all while maintaining good extension of the upper back through the entire range of motion. Now you're going to need either a heavy ball, like this is a 2-pounder here, 3-pounder, or some form of dumbbell for some of the exercises coming up. Like you saw in that intro clip, we've got Justin in this long half kneeling position where now he's working on his hamstring flexibility, because we try to work on as many things at once as we can. We know that throwers need hamstring flexibility, especially pitchers, because they get their chest forward far in the throw. So we're working on hamstring flexibility. There's a little instability because you're in that kind of kneeling position. And then he's working on some of the decelerator strength in what we call an empty can style exercise, which is where the shoulder goes as you finish and decelerate your arm. So we're going to work on some of this decelerator strength. And then after we work on that, we're going to give the shoulder a little bit of a break, at least from that particular motion. And we're going to go into a lateral walking variation. And we could do this as 2 exercises, but we find that it works really well to do them simultaneously. So we're going to work on that control. So we're working on a little core control, a little bit of thoracic extension once again, which means getting that back nice and extended, good posture. And then we're going to work on some of the muscles that control the shoulder blade around that back side that attach to that scapula. And so we're going to hold this position isometrically, meaning not moving, and do some side-to-side stepping. That side-to-side stepping, we can start to work on some hip strength at the same time and put a loop band around the ankles. So we love this variation for all of our throwers, but it really starts to work on some of the postural muscles. It gives us a little bit of anti-rotation work through the core. So you can combine a lot of exercises, get a lot of benefits out of doing something like this, where we're going to hit the hips in the same muscles that help us drive down the mound. We're going to hit our core a little bit, and then we're going to really hit that shoulder hard in a different motion. From there, we'll jump into a table exercise, because one of the issues that we often have with athletes is they have a hard time moving their shoulder blade around the rib cage as they should. So we do an external rotation exercise now, where we're working on some of the rotator cuff muscles in the shoulder, but we're bringing the arm around the body, which teaches that shoulder blade how to kind of move around the ribs, which we really feel like is important. And from there, he's got to maintain that end range turnout or external rotation here without letting the wrist drop at all. These exercises with weights, we try to load them up when we can and measure the progress. So each and every week at the very least, we have progression. We don't want to see the same weight done for the same reps over a long period of time unless we're just building up some sort of endurance or maintenance work. In reality, in a rehabilitation program like what you guys are in right now, if you're watching this video, you need something that builds you up, and that's why we measure sets, reps, and load. Once we work on the rotator cuff a little bit in the positions and in the ranges of motion that we need it to be strong for the throw, we'll start to work on just some general strength, some general type of overhead pressing type of work with a landmine, because we can follow a natural arc. Now keep in mind, if you start standing up with a landmine press, you don't get very far overhead no matter where you grab that pole. Now the further I get in towards it, the less load, the more awkward it gets, and kind of the more overhead I get. But what you can easily do is kneel down, and you can lean into the press as you get overhead. Now, one of the things we want to be careful of that we often see in our athletes, and I've just got it stuck in the corner over here. We do actually have a landmine attachment over there, but I know most of you guys are going to work with limited setup. So if you guys are at a commercial gym with a landmine attachment, they're really, really nice. But one of the things we want to be careful of is this kind of overhead pressing motion. This overhead pressing motion, a lot of times that scapular movement in combination with the movement of the clavicle in the front, or the collarbone, as we may call it, sometimes just doesn't work well. There's sometimes some instability after the surgery based on how they go in. And so we have to go into more lateral press variation. And that's what we used here with Justin. It's just a lateral press. We start very light. We don't even have a regulation bar here. And we'll progress it to a barbell, a regular barbell with some weight on it. From there, we'll go into an instability style press where we have a banded variation with the band resisting pulling the arm into flexion. So we're working on some of the muscles that actually pull the arm down into extension, a little bit of the pec, some of the lat overhead, just to incorporate some more lat stability, some front of the shoulder stability, while that weight is in the middle of the band, so the weight bounces around all over the place. We find that putting people in that half kneel position with the ribs tucked down and the chest up really forces them to stabilize the core and make sure the shoulder movement is very clean. From there, we'll actually flip them around. So now the band is pulling forward, so doing the exact opposite. We find that's more difficult, but also very effective. And that's a basic routine. Now we're doing more exercises than this with Justin. We're doing some throwing stuff, as you guys will see in that other video if you haven't yet. These are just some of the important things to consider and some of the exercises you can begin to use. And if you find you're doing like that external rotation around the rib cage and you're not really getting much work out of it, it's probably because you're losing the motion. You're not keeping that shoulder where you want it to be. And the same thing with the rest of these. Most of these are doable, but a little bit challenging. And if they're not, you need to up the weight, or really, more importantly, go back and check your technique, which is one of the most important things, especially considering that you had a thoracic surgery and you really need to work on your posture. That's it for this video. Make sure you guys hit the thumbs up and subscribe if you enjoyed the video. If you haven't yet, go back and check out the throwing one. I hope to see you guys in the next video. If you are new to the channel, make sure to hit the bell for notifications so you don't miss anything coming up in the future, because we're going to have more stuff on thoracic outlet syndrome. We'll see you guys then.